As a brain specialist with over 2 decades in the field of neurology, I never thought I'd find myself warning patients about something as seemingly innocent as vitamins. But what I've seen in recent years has compelled me to speak up. Today, I'm going to take you into the hidden world of over-the-counter supplements, the very vitamins millions of people trust to enhance their health, and reveal how 7 specific ones can increase the risk of stroke, sometimes dramatically and often without warning. What I'm about to share is based on real patients, peer-reviewed data, and clinical insights that rarely make it into headlines. And if you stick with me until the end, I'll reveal a vitamin combination I now call the silent clot pair, because of how dangerously common yet silently risky it is. Let me introduce you to my patient Lisa. Lisa is a 37-year-old mother of 2, works a high-stress job in tech, and tries hard to stay healthy. She runs 3 times a week, eats mostly organic, and takes a stack of supplements she researched on wellness blogs. Her regimen includes a multivitamin, a B complex, omega-3s, magnesium, and a high-dose vitamin D capsule she ordered online. When Lisa came into my clinic, she wasn't complaining about anything dramatic, just occasional dizziness, tingling in her fingers, and a strange sense of confusion she couldn't explain. Her MRI, however, showed something alarming, tiny spots in the brain that indicated she'd had several small silent strokes. No trauma, no diagnosed medical condition. We ran a full panel of tests. Her homocysteine levels were off the charts, calcium levels elevated, and blood viscosity thicker than it should be. What caused it? The supplements. First on our list is vitamin B6. Often promoted for brain and nerve health, B6 is essential, but only in moderation. High levels, especially when taken with B12 and folic acid, can become dangerous. Most people don't realize that excessive B6 can lead to nerve damage. But more importantly for stroke risk, B6 plays a direct role in homocysteine metabolism. When taken in unregulated, megadoses, B6 can actually disrupt this balance in genetically predisposed individuals, particularly those with MTHFR gene mutations, which affect nearly half the population. High homocysteine is a well-documented stroke risk, and B6, ironically taken to support brain function, can elevate that risk. Then there's vitamin B12, which is next on the list. Now, B12 is a crucial vitamin, especially for vegetarians, vegans, and older adults. But many people take B12 shots or high-dose tablets thinking more is better. What they don't understand is that B12 doesn't flush out easily like other water-soluble vitamins. In excess, it can alter how the blood clots. I had a patient, Mark, 45 years old, no history of stroke, who took weekly B12 injections for energy. He thought it was harmless until he experienced a transient ischemic attack, a mini-stroke while driving. His labs revealed elevated red blood cell count and increased blood thickness. When we traced the cause, the B12 doses were 5 times above recommended levels. Vitamin E is often seen as an antioxidant hero. Marketed for heart and skin health, vitamin E supplementation has become popular among those wanting to age gracefully. But most don't realize that vitamin E is a natural blood thinner. In doses above 400 IU per day, it interferes with platelet function, your body's ability to stop bleeding. For some individuals, this can be beneficial. But for many, especially those also taking aspirin, fish oil, or even turmeric, it becomes a recipe for hemorrhagic stroke. I remember a fitness coach named Jenna. She collapsed during a gym session. Her CT scan showed a brain bleed, not trauma-induced, but internal. Her daily health routine included green smoothies, omega supplements, turmeric, and a 600 IU vitamin E soft gel. No one ever told her these ingredients interact. Next up, vitamin D. Yes, the sunshine vitamin. Over the past decade, we've seen a surge in high-dose vitamin D supplementation. It's prescribed for mood, immunity, bones, you name it. But vitamin D isn't just a feel-good nutrient. It regulates calcium absorption. When overused, it causes calcium to flood the bloodstream. This condition, hypercalcemia, leads to vascular calcification, where arteries stiffen and narrow. That means less blood gets to your brain and your stroke risk skyrockets. I had a patient named Joe, middle-aged, health-conscious, and enthusiastic about supplements. He was taking 10,000 international units of vitamin D daily. His calcium was dangerously high, and a carotid ultrasound revealed arterial narrowing. He had no idea that the vitamin he believed protected his bones was quietly damaging his vessels. Folate, or more precisely, synthetic folic acid, is another tricky one. Folate is critical for DNA synthesis and cell repair, and it's routinely added to cereals and prenatal vitamins. But here's what they don't tell you. The synthetic form, folic acid, can accumulate in the bloodstream when taken in excess. When combined with other B vitamins, particularly in methylated supplement stacks, it can actually increase the risk of seizure-like activity in the brain and trigger vascular stress. I treated a postpartum patient, Sasha, who had been taking double her prenatal vitamin along with a methylfolate supplement recommended by an influencer. She suffered a minor stroke 3 weeks after delivery. No infection, no clotting disorder, just an overloaded, hyper-reactive nutrient profile. Now let's talk about niacin, or vitamin B3. This one is used in medicine to lower cholesterol, but people often self-medicate with it to detox the brain or improve circulation. High doses cause blood vessels to dilate, which some people feel as a flush or tingle. But this vasodilation can backfire. If your blood pressure drops too suddenly, or if your vessels can't regulate properly, parts of your brain may not receive consistent oxygen flow. One of my patients, Eli, took 2,000 milligrams of niacin a day after reading about it on a biohacking forum. He felt great for a few weeks. Then he blacked out during a hike. Brain imaging revealed a stroke from uneven cerebral blood flow. He'd essentially starved his own brain of oxygen through unstable circulation. Vitamin A, especially in its preformed version known as retinol, rounds out our list. Unlike plant-based beta-carotene, retinol builds up in fatty tissues, including the brain. In large amounts, it leads to increased pressure inside the skull, called pseudotumor cerebri. This pressure mimics stroke symptoms, vision changes, headaches, nausea, and sometimes nerve compression. I treated a teenage athlete who had been taking a skin-clearing supplement with 25,000 international units of vitamin A per day. She came in with blurred vision and trouble walking. No tumor, no injury, just too much of a vitamin she thought was helping. Now I want to talk about something almost no one considers: combinations. The average supplement taker is combining products, multivitamins, energy boosters, sleep aids, immune pills, without realizing that the ingredients overlap. The stacking effect can be catastrophic. Even if you take one pill with 100% of your daily value, taking 4 other pills that contain the same nutrients can quickly push you into toxic territory. I saw this with a patient named Danica. She took a multivitamin, a bone support supplement, a sleep gummy with melatonin and B6, and an energy shot with B vitamins. On paper, nothing seemed extreme, but when we added up her daily intake, she was consuming over 1,200% of the recommended dose for B6, 800% for folic acid, and 700% for niacin. She came in with confusion, weakness, and visual auras. Her brain was inflamed, literally irritated from nutrient overload. If you're wondering how you can protect yourself, it starts with 3 words: test, track, adjust. Get a comprehensive blood panel that checks for homocysteine, B vitamin levels, calcium, and clotting factors. Don't guess, measure. Track what you're taking, read every label, check for overlaps, and then adjust. Don't keep taking something just because it worked once or because a health influencer said it's clean. Your body changes, your needs shift, and what helps one person can harm another. I promised I'd share the most deceptive combination, and here it is: high-dose vitamin D paired with vitamin K2. This duo is often sold as the bone and heart health formula. On its own, it sounds genius. D helps absorb calcium, K2 directs it into bones. But here's the catch: if you're taking more calcium from other sources, like dairy or antacids, this combo can accelerate arterial calcification. It's especially risky if your kidneys aren't filtering efficiently. I had a colleague, yes, another doctor, who took this combo religiously. He ran marathons, ate clean, never smoked. He collapsed on a treadmill at 51. His CT angiogram showed advanced calcification and cerebral artery narrowing. No one suspected vitamins, but they were the silent contributors,